Obesity is a problem in America as 2 in 5 U.S. adults are dangerously overweight. The CDC describes obesity as a disease that can cause many health conditions such as heart disease, type 2 diabetes, and some cancers. For some, losing weight isn't as simple as diet and exercise.
That's when a doctor may recommend bariatric surgery. It's a category of surgeries where doctors modify the digestive system to regulate calorie intake. The most common is the gastric sleeve, a procedure that removes about 80% of the stomach. According to the Cleveland Clinic, it's widely used because it's relatively simple and safe with little risk for complications. A grandmother who struggled with her weight for many years says undergoing a bariatric surgery may have saved her life.
Reporter Tan Trung shares her story and explains why one hospital's weight loss program is growing.
For many years, Tomeka Jones says she struggled with diabetes and her weight. She tried exercise, diets, and medications.
Just couldn't do it no more, walking, because I was having problems with my legs and stuff, and I couldn't walk on my legs like I used to.
This is Tomeka before September 2023, when she underwent bariatric surgery at University Medical Center, New Orleans. This is Tomeka after. Today, the 51-year-old grandmother from Gentilly says her mobility is better. So is her outlook on life.
I have to live for my children and my grandchildren.
Do you think this saved your life? Do you think this procedure saved your life?
Yeah.
And in terms of severe obesity or patients that would qualify for bariatric surgery, it's around 30 to 35%, which is higher than any other state in the country.
Dr. Michael Cook is the director of UMC's bariatric surgery program, which began 6 years ago. It expanded, adding 3 doctors and opening a 16-bed area in the hospital. Dr. Cook says much like the recent demand for obesity drugs like Ozempic and Wegovy, more people are seeking bariatric surgery to address their worries with weight.
Without any advertising, just by word of mouth, we very quickly grew to where there were thousands of patients seeking surgery, and we have a limit to the number of people that we can actually perform on.
UMC performed about 400 bariatric surgeries last year. With this recent expansion, Dr. Cook says they expect to double that number next year. Whether they choose obesity meds or bariatric surgery, Dr. Cook wants patients to know work is required to maintain their ideal weight.
So it's almost like quitting smoking. If you're not ready to quit, then you're not ever going to be successful. So if you're ready to make that full commitment, then we'll help you through the process.
For Tomeka Jones, walking through life has never felt better. According to the federal government, Medicare covers some bariatric surgical procedures if patients meet requirements. UMC New Orleans tells me private health insurance plans may have different requirements for coverage. Reporting in New Orleans, I'm Tan Trung.
It's difficult to talk about weight loss without mentioning the explosion of injectable drugs. According to the Mayo Clinic, the drugs under the generic name semaglutide and tirzepatide work in your brain, gut, and pancreas to decrease cravings. They can also decrease stomach flow so the stomach gets full faster and stays full longer.